Well, one of the things that is still needs to really roll out is what is the efficiency of transmissibility in a sustained way. We know certainly it's jumped from from animals to humans, and it can infect human to human. But the critical issue, would it be sustained? And when sustained means one person to another, to another, to another, like we see with influenza. It is unclear at this point whether that's occurring. If that does occur, this will turn out to be much more serious than what we're looking at right now. Hopefully it won't. If it's similar to SARS, which we saw in 2002, even though there were 8,000 cases and 775 deaths, ultimately we were able to contain it because it didn't efficiently go from person to person.
So, in other words, and forgive me if I'm oversimplifying this, but I'm just trying to understand the science here. If we do see sustained spread to the point of an epidemic, it's only then, after the event almost, Anthony, that the World Health Organization will start to declare an emergency on a global level, and we will see travel restrictions, etc. Isn't that arguably closing the barn door after the horse has bolted?
I can tell you, Sri, that that's exactly what I said a moment ago. There are some people who would argue either way. Some people would say you don't want to call out all the resources. And there are others that say, why not? Why don't we call it an emergency and go ahead and do whatever it is that happens when you call something an emergency? So you make a valid point. There are people who can argue very strongly as to what you're saying.
All right. The fact that the Chinese health authorities, with the Wuhan lockdown, and they've taken unprecedented action here, have they effectively tackled and cut off the problem at the source? Just how decisive was that action?
Well, that is really quite a dramatic action, to actually shut off public transportation from a city like Wuhan that has 11 million people in it. That is most extraordinary. I can't imagine that happening in a city like New York or Los Angeles or San Francisco. But the Chinese authorities feel, and they could have reasons that you could justify, that if they do that, they could then cut down the essential dispersion of cases throughout the country. What they're concerned about is that it started off in Wuhan, but now you're having cases in Beijing, in Hong Kong, in Shanghai, and they feel if they cut off transportation, they could tackle that. They might be right. And I think only experience is going to prove them either correct or incorrect.